A doctor who is aware of the syndrome can suspect the diagnosis, but confirmation requires referral for further testing. There are 3 specialist centres that offer a screening and diagnostic service: Leicester Royal Infirmary, the Royal Brompton Hospital in London, and Southampton General Hospital. Patients may be referred to any of these centres. Patients are seen by a consultant who asks them questions about their problems and examines them. If they, the doctor, feels the patient needs testing for PCD, the first test that is usually done is measurement of a gas called nitric oxide. There is a simpler screening test for adults and older children called a saccharin test, but it is not as reliable as the nitric oxide screening test. It is rarely used in older children and is unreliable in young children. However, it is still occasionally used as a screening test for adults. This slow-motion video shows healthy cilia beating normally. This video shows healthy cilia looking from above. Initially they are shown in slow motion, and then in real time. You can see the immense amount of energy they generate to move mucus out of the airways. The cilia from patients with PCD do not beat normally. This video shows the cilia of a patient with PCD due to the absence of the motors that make the cilia beat. As you can see, the cilia are static. This video shows the cilia of a patient with PCD due to an absence of the motors that make the cilia bend properly. As you can see, the cilia move but do not bend as well as healthy cilia. Susceptibility to lung infections can be drastically reduced by a diagnosis in early life. Subsequent treatment helps prevent the lungs being damaged or colonized by bacteria that cause infection during this vulnerable period. However, diagnosis is often missed early in life despite the characteristic signs and symptoms, as many small children have coughs and colds on a regular basis. As yet, no test for prenatal diagnosis is available, although situs inversus can be detected using ultrasound imaging before birth. The discovery of situs abnormalities on antenatal scans should prompt a request for review at one of the diagnostic centres after birth. PCD is not the only cause of situs inversus, but it is a common known cause that can be readily confirmed or excluded early in life.